Okay, got it. So, my topic is LASIK eye surgery, just in case you want to write it down first. Okay, so I've been wearing glasses for about a decade now, and there has not been a day I just want to take them off and go about my day. So I decided to talk to you about LASIK eye surgery on people with eye conditions and all the benefits, risks, and side effects. If you have glasses or if you have family who have glasses, you probably have heard about LASIK eye surgery about probably a million times. So starting with the benefits and effectiveness of LASIK, we will then move on to the side effects of LASIK eye surgery, and lastly, we're going to talk about the risks of the surgery, because even the easiest surgeries have risks. Let's start by talking about the benefits. Ophthalmologist Alan Kostarski wrote on April 16, 2020 on the WebMDW website that the surgery is associated with very little pain because of the drops that they use to numb the eyes, which wear off about 20 to 30 minutes after the surgery. LASIK is very quick, it's safe, and in an interview with ophthalmologist Christopher Hood, he said that whether they choose LASIK or PRK, which is photorefractive keratectomy, many patients view the prospect of the surgery as life-changing. Some patients' testimonies are that 24 hours after having the LASIK eye surgery, their vision it's completely perfect, 20/20 vision. Now that we've talked about the amazing outcomes and benefits of LASIK surgery, let's talk about the side effects that the surgery has. Just as any other surgery, LASIK has many side effects that with time could be fixed, or even they will have to need another LASIK surgery, like a follow-up. One of the most common side effects is dry eyes, because LASIK reduces the production of tears within the first 6 months after the surgery. Other common symptoms are seeing glares, halos, even having double vision, and sensibility to light within a few minutes after the surgery. Another important side effect that is not as common but still listed is flap problems or infections. The flap is the little corneal tissue that they have to kind of open up and flip it to the part of the eye, the top part of the eye, so that the laser can hit right to the eye without anything covering it up. With every single surgery, there comes some risks that we need to be aware of before getting into it. For LASIK, the risks are not as common, and according to the article, LASIK complication rate, the latest facts and stats that you need to know, written in 2017, the stats and rate of complication for LASIK eye surgery is under 1%. So it's very safe. That's what they say, at least. Undercorrection is one of the not that common risks for the LASIK eye surgery. This happened when the laser removes too much tissue from the eye, and it causes patients to not have that clearer vision that they want. Then we have the overcorrections, and this ones occur when the laser The undercorrections happen when the laser takes too little tissue, and the overcorrections happen when the laser takes too much tissue. And overcorrections are harder to fix than undercorrections, so people tend to not have this one. They're not as common. And the least common is loss of vision. Never happens. But they still list it as one of the risks on the pamphlets that they use. So it's time to wrap up, and let's go back to the points that I talked to you about before. We talked about the benefits and everything that makes LASIK an amazing option for people with eye conditions. Then we talked about how every surgery has side effects. And lastly, we talked about the risks and the low complication within LASIK. All of this being said, LASIK eye surgery seems to be the most affordable, easiest, harmless, and quickest option for people to find a solution for their eye disability. And I can talk for all of us, people who wear glasses, but I am so looking forward to the day we can all stop wearing glasses and we can finally see the world